thank you everyone for joining the Healthy Schools Toolkit 101 webinar. We're so excited to have you here today and to be able to share with you more about the Healthy Schools Toolkit. We're quite overwhelmed by the excitement and the amount of folks interested in this work, so we're excited to hear your questions and to be able to get connected to you. So thanks again. My name is Emily Kreiser, and you'll hear my voice pop in on occasion today. I'm just going to help facilitate the question and answer and polling parts of the webinar. And if you received your registration confirmation email, that was included my contact information. So if you have any questions after the webinar, don't hesitate to reach out to me. So I'm very happy to be able to introduce our hosts today. They are Jason Purnell and Nicole Lobb-Doherty. Jason Purnell is an associate professor at the Brown School at Washington University in St. Louis. He's trained in both applied psychology and public health, and his research focuses on how socioeconomic and sociocultural factors influence health behaviors and health outcomes. He is the director of Health Equity Works, an initiative of the Brown School at Washington University, which is committed to translating data and research into collaborative community action to advance health equity. Nicole Lobb-Doherty is the Associate Director at the Brown School Evaluation Center at Washington University in St. Louis. She has over 15 years of experience in program and systems level evaluation, project management, evaluation capacity building, data visualization. Before Nicole came to the Brown School, she worked at a nonprofit in New York City where she oversaw the evaluation of roughly 100 out-of-school time and summer programs. So a lot of great experience working with schools and educators. So we're very excited to have our hosts today and very excited to have you all on. And I'm going to turn it over to Nicole, who's going to get us started on the rest of our webinar.
Thank you, Emily. Today, we will focus on answering a few questions, starting with why should we consider health and education together? After that, we will dive into what makes a school healthy, safe, and successful, and the question of how can a healthy school be created? We will then turn to you to see what questions you have for us. I know many of you are familiar with Zoom settings, so I'll take just a moment to highlight some of the features. By clicking on the lower left corner, you'll be able to adjust your audio settings. You are currently all muted. Then there's chat and raise hand, which is highlighted here. This activates the hand and raise hand and lower hand features, followed by the Q&A panel. Please submit questions or comments during the webinar. We'll collect these and address them during the Q&A portion of the webinar. We will also use Zoom's polling feature to ask you for your input throughout the webinar. When we do, a series of questions and answer options will become visible on your screen. Thank you in advance for your participation. Finally, the View Options menu at the top of the display is where you can adjust your Zoom viewing window. Okay, I'm going to have you all practice a little bit using your raise hand feature. I'd like to see by a show of hands of those who think you would like to receive a recording of today's webinar. We have a lot of hands going up. All right, I think it's the vast majority of you, which is great to see. You'll be happy to know that a recording of the webinar will be available on our website early next week. And we will also send an email to all of those who registered, letting them know when the recording is available. We are going to start with our first poll to get a sense of the framing everyone brings to our discussion. In a few moments, you will see a series of 5 questions on your screen. Please take a few minutes to scroll through the questions and provide your responses. Our first question is, have you heard of the whole school, whole community, whole child model? This model is commonly abbreviated as WSCC, or WSCC for short. If you aren't familiar with the WSCC model, that's not a problem. We'll spend a portion of today reviewing the model. Our second question asks you to consider the extent to which you agree that you currently have the tools you need to create a healthy school. Our next three questions ask you to rate the importance of something to creating a healthy school. First, please consider how important people are in creating a healthy school. The answer options range from very important to not at all important. And if you're not sure, then feel free to provide that as an answer as well. Next, consider how important systems are in creating a healthy school, with the same response options. And finally, how important are messages in creating a healthy school? So a quick glance of our results here, you can see that most of you had heard of the WSCC model, almost about a third of you, and roughly a third or so of you have also heard about it but don't know it well. So thank you for your participation in this. It's very helpful. We'll start today's discussion by talking about why it is important to consider education and health together. One reason is that there's a close and bidirectional relationship between health and education. Not only are higher levels of education associated with good health, but children and families in good health tend to have better education-related outcomes. Many of you are intimately familiar with the ways this bidirectional relationship plays out. You see it every day. A simple illness, whether it's for a student or a family member, compounded by a lack of access to healthcare or other community or interpersonal barriers, can quickly escalate to many days missed and a dip in academic performance. This single experience is amplified across a student's life as one's educational attainment has a direct impact on one's ability to be employed, which in turn provides greater access to safe neighborhoods, quality housing, medical care, and health insurance, among many other things. In fact, research suggests that policies that address social factors like education could have a bigger influence on health than all medical advances combined. For many of you joining us today, the notion that health is a vital and necessary part of education is likely not a new idea. It is an important place to start, however, because it underlies the significance of the next question: what makes a school healthy? Put another way, what factors should schools consider are as essential to making a healthy school? The first step to answering this question is understanding what our goal or North Star is. Educators have taught us that a whole child approach, which ensures that all students are healthy, safe, engaged, supported, and challenged, should be at the center of everything we do. Researchers have also identified 10 components that need to be addressed to achieve whole child health and support the physical, social, emotional, academic, and cognitive aspects of students. These components range from things that are more traditional to the school health field, such as physical education and activity, and nutrition, environment, and services, to more emerging priorities, such as employee wellness and social and emotional climate. Together, these components create a holistic, comprehensive approach to a healthy school. Wrapping around all of this is the community. As you all know, schools and educators can't address all of these components by themselves. Community partners are critical to schools having the capacity to meet students' needs. We are also reminded that not all communities have the same resources or face the same challenges. Some schools and districts may have easier access to partners who can respond to students' needs while others don't. All of this requires us to apply an equity lens to our work. And finally, the aspect of coordination. Although easily overlooked, the coordinating policy, process, and practice ring is perhaps the glue that binds all of the other rings together. The image that has emerged here is the whole school, whole community, whole child model. The WSC model is a comprehensive framework designed to represent the ideal atmosphere for improving students' health and educational outcomes. The model was co-developed by ASCD and the Centers for Disease Control and Prevention in 2014, and since that time, substantial evidence demonstrates the model is effective. However, conflicting priorities and limited resources continue to be barriers to fully adopting or implementing the WSC model in all schools and districts. The WSC model itself doesn't provide much information about the how-to of implementation. This is where we see the value of the Healthy Schools Toolkit. It helps us unpack or operationalize what it means to align policy, process, and practice in the context of the WSC model. We believe the how-to lies in understanding the people, systems, and messages necessary for implementation. As we like to say, frameworks don't implement themselves. Rather, people embedded within functional systems and armed with the right messages implement frameworks. Over the past 2 years, our team has utilized 3 social science methods, namely social network analysis, group model building, and message testing to identify and leverage the people, systems, and messages needed to support implementation of the WSC model. This work has been funded as part of the Together for Healthy and Successful Schools, an initiative of the Robert Wood Johnson Foundation. As the research and translation arm of the initiative, we partnered with the Normandy Schools Collaborative and St. Louis Public Schools, both high-needs St. Louis area school districts, to conduct research in order to determine the key relationships, messages, and systems necessary to make schools healthy environments for learning and development. And using our findings, we worked with our partners to co-develop the Healthy Schools Toolkit, a tool designed to help educators build healthy school communities that support the whole child and lead to student success. We have been joined by 2 other co-grantees, America's Promise Alliance and Child Trends, who have focused on strategic action and alignment and policy, respectively. We released the toolkit to schools and district leaders in the St. Louis region this past summer. So we'll pause for a moment for a quick poll question. Before today's webinar, were you familiar with the Healthy Schools Toolkit? Yes, you had heard of it and you had looked through some of it. You had heard of it, but hadn't looked to the toolkit. No, you have not heard of it, or I'm not sure. So we have responses coming in. Thank you for participating. And it looks like the majority of you had not heard of it. So thank you, that's great. So glad you're here to learn a little bit more about it today. Our goal in developing the Healthy Schools Toolkit was to create a unique tool that gave explicit instruction to help school and district leaders understand and leverage their people, systems, and messages in implementing the WSC model. As we'll share in more depth later on, the toolkit is divided into 3 separate modules focused on the people, systems, and messages. This allows schools and districts to do the work at their own pace and to order the work according to their needs. Over the next few slides, we'll provide a brief introduction to some of the features of the toolkit. One of the most important features of the toolkit is that it builds on and complements existing WSC resources. Throughout the toolkit, You'll see that we call out when the toolkit aligns with processes described in other resources, such as the National Association of Chronic Disease Directors WISC Implementation Guide. The toolkit also emphasizes process. We feel that educators get a new what every year, and we wanted to make sure that this toolkit answers the how. The processes required to complete each module is detailed in step-by-step instructions as outlined in the Quick Start Guide shown here. And each module features a series of templates and activities like the one shown here that breaks down each step into small, actionable chunks. We also felt it was important to provide clear examples of the impact this work can have on schools and districts. Each module starts with a hypothetical story, as shown here, and each of the modules also ends with an in-depth case study based on our experience doing this work in St. Louis. Finally, we felt it was important that the processes described in the toolkit can be applicable to any school or district, regardless of their needs and resource levels. For this reason, we developed a spectrum of activities and options that can help schools and districts customize the work to what is feasible for them. The time, resources, and expertise needed for each option is outlined at the start of each module in an options chart. This chart also includes the outcomes that are possible from each option. We'd now like to spend some time providing a brief overview to the processes detailed in each module. I'll turn it over to Jason to walk us through each process.
Thank you, Nicole. I'll start with social network analysis. Social network analysis allows us to understand the characteristics of a school or district's social network. It tells us how information is shared within a community, who the key players are in sharing that information, and offers suggestions for how to leverage individuals as influencers or champions. The social network analysis process is broken down into 6 steps in the Healthy Schools Toolkit. Within each of these steps, there are a variety of ways to customize the work to your informational needs and capacity. The 3 options by which you can customize your work allow for slightly different outcomes. Option A helps you to identify potential key influencers based upon recommendations. Option B builds on that and allows you to measure the frequency of communication and the level of trust that key influencers have with others in the social network. Option C takes it one step further and provides a visual representation or a map of the social network, thus providing you with more information about the barriers and facilitators to sharing information. The network map that is possible if you choose option C is dense with information. Each dot represents an individual in a social network. Each line represents connections between individuals. These dots can be colored and sized according to the individual's role and the number of connections they have with others. Depending on what option you choose to pursue, you can begin to understand some key characteristics of your school or your district's social network, including the density of your network and the number of cross-role relationships that exist. Both are key features that help predict how easy or difficult it will be for your school or district to implement a change. Before I move on to the next module, I want to ask you all to use the raise hand feature to indicate whether your school, district, or organization is currently employing a strategy to identify who its key champions are and how those champions are connected to others. So it looks like a few of you are engaged in this, but not many, and hopefully the toolkit can help you to identify those champions for you. Thank you. Group model building is the process highlighted in the second module of the toolkit on systems. It helps groups of people solve large, complex problems together. In our research, we used group model building to help school and district stakeholders identify the factors that impact healthy, safe, and successful school systems and understand how those factors are connected to one another. Group model building also allows stakeholders to identify opportunities to intervene and the intended and unintended consequences of each intervention. At its core, group model building allows groups to solve problems as a team. This is accomplished through a variety of activities. The grounding to all of these activities, though, is the idea that you're bringing people who have different perspectives together to piece together what is really going on and identify potential solutions. This process can be described in similar terms as the famous parable of the blindfolded persons and the elephant. As the image shows, if a blindfolded person encountered an elephant's tail, he or she would think it was a rope. But if the blindfolded person instead encountered an elephant's leg, he or she would think it was a tree trunk. We, like the blindfolded people, are all limited by our perspective. And it's only once everyone is at the table that a problem can really be understood. Like the people module, the systems module is broken into a series of steps, and you can customize your work according to your needs and capacity. In this module, however, the complexity of options builds in terms of the number of people and perspectives you include in the process. As you involve more people, you are able to not only create a map of systems, structures, and policies needed to implement the WSCC model, but you are also able to build common language and understanding of the factors that influence a healthy school and create new partnerships and connections to support the work. And as you include more and more people and perspectives, you can be confident that the model you build is reflective of the experience of various perspectives and roles in your school community. One of the outputs of group model building are causal loop diagrams. As an example of a causal loop diagram from our research in St. Louis is shared here. What is illustrated are those factors, like parental involvement, that stakeholders feel impact the school environment. The arrows connecting the factors specify the direction and polarity of the relationship between factors. For example, our stakeholders indicated that parental involvement has a positive relationship with attendance. As parental involvement increases, attendance also increases. As you might notice, these diagrams can become quite complex. Thankfully, there are several methods to make meaning of this complexity. One option is to apply the WSCC model to the diagram to identify the ways in which individual WSCC components contribute to a school system. In this version of the causal loop diagram, you can see we have overlaid the components of the WSCC model that stakeholders identified in their discussion. For those of you who are familiar with the WSCC model, you may notice that not all WSCC components are identified. This in itself can be a revelation in understanding what shows up when you ask people what contributes to a healthy school. It's also interesting to note which components are more intertwined. For example, employee wellness, which our stakeholders identified as being tightly connected with social and emotional climate. These are just some of the ways to unpack the meaning of these diagrams. Another way is to highlight opportunities for intervention. The black dotted lines you see here are those intervention points identified by the stakeholders with whom we worked. We'll pause here again before the next module. Please raise your hand to indicate whether your school, district, or organization is currently using a strategy to understand how its systems work or function. So again, relatively few of you are engaging in a system strategy. Again, we hope the toolkit can be useful to you in this regard. The process that is highlighted in the third module of the toolkit is message development and testing. Message testing is an iterative process that helps to identify messages and stories that resonate with key stakeholders. It is also useful in identifying effective messengers and messaging strategies for different stakeholder audiences. The messages module is broken down into 5 steps, and like the other modules, there are 3 options by which you can customize your work. Option A allows you to use messages that have worked in other schools and districts to create effective messaging campaigns in your own community. Option B introduces some tailoring activities to allow you to identify specific messengers and messages that resonate with audiences in your school or district. And option C allows for additional tailoring, but this time of the messaging strategies. The output from message testing is a little less complicated than the first 2 modules. The messages shown here are the ones that tested well among the schools and districts with whom we conducted our research. We found that messages that express empathy for students and families, that are relatable to lived experiences of educators, and that make a specific ask resonate with stakeholders. It is also important for those messages to be shared by well-connected and trusted leaders and peers. In these examples, you can see the themes of teamwork and empathy. As a result of working through the toolkit, you'll be able to understand 3 key elements of an effective messenger. The who, the messenger, the what, the message, and the how, the messaging strategy. For each of these elements, the toolkit provides some activities and tools that help schools and districts identify the specific who, what, and how that allows their messages to reach the right people and have the impact that they want. For example, for messengers, the toolkit provides an overview of the unique communication-related qualities that different messengers provide to a school or district. The toolkit also provides a message framing activity, which guides schools and districts in developing and testing specific messages among different audiences. There's much to consider when it comes to messaging strategies. Do people at your school read and respond to email, text messages, phone calls? Do they prefer one-on-one messaging? These factors and more are addressed in the toolkit. Before we turn to your questions, we want to share a brief video with you. It highlights the impact that this work has had on some of our partners.
I am Dr. Calvin Adams, Superintendent of St. Louis Public Schools. First of all, I've learned that we have a number of resources that are already available to us. that have not necessarily been maximally leveraged. The district has understood that now and has created an eco map, if you will, for every single school, such that we know better what resources are available to us, and as a result of that, are beginning to start determining how best to leverage the human resources that are in our building. I think historically, we have asked for everything without clearly defining what we needed and how we were going to use those things. Now I think as a result of this work, there's a lot more clarity around what individual schools are going to need and how those individual schools can work to use those resources. And lastly, I think what I'm believing that will happen long term is that we will build some systems that have historically not been built in our district, but the eco map keeps it in front of us on a regular basis. I think we have the framework to do so. In the conversation I had this morning with the clergy, they asked me what was one of the most challenging things about the work that we do. And quite frankly, it's this work. It's about getting people to work together and not in silos. This work forces that to happen.
I'm Dr. Charles Pearson, Superintendent of Schools in the Normandy Schools Collaborative. So we always talk about the fact that people are important to doing change in a system. But one of the things the process informed me of is that we have to really be good at identifying key people, key communicators, recognizing that there are some individuals who we expect, for example, Director of Communications to be very active. We assume that principals and others are also doing that same kind of communication. But the fact that there are teachers who are key communicators, that there may be support staff who are key communicators, that there are community individuals who are key communicators and parents, and we have to be sure we are very deliberate in getting all the right voices to the table. I thought we were being deliberate, but now that I know who actually communicates better, it's important that they become a part of that process as well. It brought to light some things that it raised the priority level, I should say, some things like mental health services. That surfaced in one of our group sessions, that was a piece we had to just pay closer attention to. This process can be used to help us do a deeper dive of that, because we can't have a successful system educationally, even socially, without us addressing those needs. When we think about what we state as a mission, our first goal is to change lives today for children. This kind of work helps us address that, because that phrase for us, changing lives, means getting children what they need to mitigate for those barriers that keep them from learning. And then that sets us up for the second part of our purpose statement, educating them for the future. This helps us with that.
I'm Katie Kaufman. I'm the director of Ready by 21 St. Louis, which is a cradle to career collaborative effort in the region. I think as a former classroom teacher myself, and as someone who's involved with a lot of school districts in the region, we know that the challenges that teachers and educators face are really complex. And while we'd like to just focus on the math or the English skills, we know that it's not that simple. The development of specific tools and techniques that educators and building leaders can use is hugely important. Systems change is a process. It's a long-term investment. So this isn't a worksheet that you can pick up one day and get everything solved by the end of the week. But the toolkit can help folks walk through it, commit to the longer term, as well as identify things that can happen right now. It is something that they can take in small chunks, and it's something to continue to revisit and really weave into the fabric, the culture of a school district, so that ultimately we can have the very best settings for kids and families to learn. I would encourage other leaders to think about again, how this is integrated into the fabric of the school, that health is not something that is in addition to or a nice to have, that really we need to be in the space of understanding that good schools are healthy schools and healthy schools are good schools. The opportunities to infuse that are really supported by this toolkit.
So now we want to turn to you to see what questions you have for us. Please type in your questions in the Q&A box. And as we wait for additional questions, we'll go ahead and answer those that have already been submitted. One of the questions is, will the recording and script be made available? Yes, the recording will be made available on our website, and we will also email all of the registrants as well. Second question is, what is the best way to advocate for health education at local schools? Health courses are often required, but are not enforced. I think one of the other grantees on the Together for Healthy and Successful Schools was Child Trends, which did an analysis of policies at the state and is turning to the local level. We don't really address kind of enforcement of health education courses within schools, but their tool, which is available on the NASB website, might be a helpful resource in thinking about ways in which school policy could be maybe strengthened in order to make sure that health education is part of what's offered in schools.
We also have another question here about, can you create these social network maps and assessments using the toolkit, or do you need additional technology or technical assistance? And we have a lot of supplemental resources, templates, and tools that are available through the website and directly linked throughout the toolkit. So a lot of that is available to you. And then we're also hoping to develop and continue to expand additional resources that would allow for you to do that on your own.
There's another question about whether or not the project was implemented in individual schools or districts. So as we mentioned earlier in the webinar, we did work with schools here in St. Louis in the development of the toolkit. We worked with the St. Louis Public Schools and the Normandy Schools Collaborative. But we are in this second phase of our work interested in, now that the toolkit has been developed, what does it look like to use it in schools and districts around the country? We'll be testing that to see kind of what are the facilitators and barriers to that use of the toolkit.
We have a couple of questions just about access to the toolkit and or videos. All of these are available on our website, which is healthyschoolstoolkit.wustl.edu. And we will again be linking to those resources as well following the webinar. There's also a question about how many people are needed to be dedicated to the project to do kind of the footwork and the analysis. And that really depends on which options are selected. We try to, every module has an options table that clearly articulates kind of the estimated time, resources, and expertise that's required to allow folks to kind of enter where they think they have the capacity and the amount of time needed. So there's variation intentionally there so it can meet people kind of where they are.
There was another question about whether the toolkit allows or covers how do you gain buy-in for a healthy schools approach. And we actually do address that head on, particularly in the messaging module, where the idea is to create messages that are going to motivate and inspire different stakeholders. And part of how you develop the messages is by asking those various stakeholder groups what's important to them and then crafting messages to bring others on board. So that is addressed.
There's also a question here about what's the best place to start at the district or the building or campus level? And I mean, we would probably love for it to be at the district level when that's feasible, but we also understand there's variability in terms of sizes of districts and the number of buildings. So if that's not feasible, you know, starting with one building or even a smattering of buildings could be a good entry point as well. There's also some questions here just about there needs to be some buy-in from top leaders for any systems change. Yes, absolutely. And what we hope that these tools allow you to do is to help you identify individuals that can help be champions to those top leaders, and also just some of the messaging that is going to resonate with them to help create that buy-in.
But another thing that we definitely emphasize in the people module is that leaders come from all levels and all roles within schools and communities. So while buy-in from the top is very often necessary to initiate change, the actual day-to-day implementation of change is going to take everybody. And the social network analysis allows you to identify maybe some of the unusual suspects in your system who aren't typically tapped for change efforts.
Just another point about how the tools can be accessed. They are all available online in PDF and downloadable form, or the videos are also on our website. Again, these are all free resources that are available online. Just scrolling through a few more of these questions to see if we have any more we can answer. There's a question here about the toolkit applicable for use by state policymakers. I think our intended audience here again is primarily for district and school leaders and educators. And so I wouldn't say the primary audience is for state policy legislators.
But I would again recommend the work that our co-grantees Child Trends has done around state level policy, which is available on the NASB website. So there's an analysis of the extent to which state level policies correspond to components of the WSC model that was conducted by Child Trends. And you can see where your state has strengths and weaknesses in terms of coverage of the WSC model.
There's a question here about how our message is sent out. Is there certain platforms, emails, newspapers? I think the messages module really helps you to identify what are the appropriate platforms for different audiences. And it may not be a one size fits all. And so it provides activities to help you identify what those are. And is it a flyer in the staff lounge, or is it an email blast, or is it a newsletter? But there's some strategies and activities that help you to identify what are the most appropriate to reach different audiences and stakeholders.
There's also a question about whether or not there's a parent's guide. Unfortunately, there is not a parent focused version of this, but we really do believe that all stakeholders should be involved as this toolkit is used. in the group model building in particular in St. Louis, we had parents as participants, but parents are also key members of any school's social network and should be enlisted and involved in the work going forward.
There's a question here about what is the best way to gather information on the connections in the causal loop diagram, and how do we survey people in our district to put in that diagram. So that is actually a facilitated process with members, stakeholder groups that are actually in the room together having conversations. And so it is an in-person kind of gathering of viewpoints and experiences to create that causal loop diagram. In our example here in St. Louis, we also then vetted that and came back together with those stakeholders to get a sense of what needed to be tweaked once it was actually developed, and then also to identify potential points of intervention. But that is actually more just the result of really rich conversations for folks about the factors they think that influence a healthy and successful and safe school. Thank you for all those that submitted questions. We're just scrolling through a few more here to see if there's a few others that we can address.
There's a question about whether or not we work with school-based health centers. Our work has included work with school-based health centers. We would consider school-based health centers to be one component of the full WSC model. So to have a comprehensive set of supports and resources within schools, school-based health centers would definitely be a key component, but certainly not the only component of the full WSC model. There's another question about how this can be used with the school health index. I think the school health index is going to help you determine the what of what you need to do in order to be in correspondence with the WSC model, and our toolkit is really the how of getting that implementation done. So they're definitely complementary to one another.
There's just a question here of if the toolkit includes assessment and evaluation tools. No, not explicitly. These are, again, just tools to help with the process and the how of implementation.
So more of a comment that very often school nurses are left out of the conversation about school health despite their critical role within schools, and also that school secretaries and unlicensed assistive health staff may have great ideas to direct priority areas. We couldn't agree more with that assessment. In our work in St. Louis, we definitely surfaced the importance of a number of roles that aren't traditionally thought of or brought to the table. And that's one of the strengths of using both social network analysis and the group model building, is to include those voices and really empower everyone from the school secretary to the custodial staff to cafeteria staff to school nurses and classroom teachers in this conversation about what does it take to make this a healthy school environment. We believe everybody has something to contribute. So we are going to turn now in our last few minutes to a final set of polling questions for you. The first question asks you to consider to what extent you agree that the Healthy Schools Toolkit can help you create a healthy school, based on what you've learned about it in this webinar. The next question asks you what your most likely next step is after this webinar to apply the Healthy Schools Toolkit in your work. For this question, you have the option of selecting multiple responses. Finally, we ask you to reassess how important people, systems, and messages are in creating a healthy school. So please take a moment to address those polling questions. So it looks like there's agreement that that the toolkit would be helpful. Most folks want to learn more and read more about the toolkit and its modules. Some are ready to share and reach out to other folks within their team. And there's general agreement that all of these factors are important as you think about healthy schools. So thank you very much for applying to the poll. And thank you all for your participation today in this webinar. We also want to thank and acknowledge the Robert Wood Johnson Foundation for supporting the development of the Healthy Schools Toolkit and their support for this webinar. And be sure to visit us at healthyschoolstoolkit.wustl.edu to check out all the videos, the toolkit, and supplementary resources included in the toolkit. While you're there, you can also contact us and sign up for updates from our team. Thank you very much. Have a good rest of your day.